A moment in the sun, a lifetime on the skin. Are you wondering what you can do now to reduce the appearance of fine lines and wrinkles after all that fun in the sun? Plastic and reconstructive surgeon Dr. Choucair is here to fill us in on all the injectable options out there. And we've been having a great conversation. Tell me this, because I have some real life questions for you. Okay. Are you ever walking down the street or go to a movie and you see someone and you're like, ooh, bad injection?
Well, unfortunately, we've gotten to the point where they're so widely used that that's very much the case. And people are obviously fearful when you see a movie star who everyone recognizes looks a little bit strange.
Right, right, exactly. Okay, so what exactly is a filler?
Well, it's a substance that's usually manufactured in a lab, that's usually not from an animal or human source, which makes it very safe, that's injected just beneath the skin to fill in a contour irregularity or a hollow or something that aging has created, like a crease or a fold or a line.
All right, and so how do they work exactly?
I mean, they're placed beneath the skin with a tiny needle, the tiniest of needles. Usually we like to use a local anesthetic because it should be virtually painless, although the myth is that it's not. And it's usually a 15 to 20 minute procedure or injection. The patient goes right home from the office with a little ice on the area that's treated, and it usually remarkably restores those areas of aging.
And it's one of the top 5 non-surgical procedures.
It is. You can see the numbers are large and growing. These have only been really available for the last 3 or 4 years in such a safe form.
Okay, so we've got a couple of products here on the table with us.
All right.
How do you know which one to use?
Well, there are judgments that you make based on where the product is injected. Juvederm and Restylane are the 2 most common products because they are the hyaluronic acid products that are the safest, and they're a gel product that is injected just inside the skin, and the body actually places water, or it basically attracts water to plump up the area. Radius is one that lasts a little longer. These last between 6 to 10 months, some people longer. Radius can last up to a year to a year and a half. It's more of a mineral that we inject just beneath the skin.
So how do you know which one to use where?
Well, it's the judgment of the surgeon, and of course patients have some say in it because they want the one that maybe lasts the longest, but there's pluses and minuses to each product.
All right. We've got some before and after pictures. Just walk us through this and tell us what you might have used and what the benefits are. All right. This is around the mouth?
This is a young lady who is tall and thin, and so, you know, when you have a thinner face, you tend to look older because the deflated face just tends to look a little bit more aging because a young face is full. So she's had it injected along the fold from the nose down to the corner of the mouth. You see those lines around the side of the mouth were injected with Restylane, which is a very forgiving product superficially, and then we put a little bit in the lips.
Now, are those pictures reversed?
The one on my right is, of course, the before, and the one on the left is the after. Exactly.
Okay, all right, very good. Let's take a look at another one, too. We've got a couple of different examples to show you, because there are different areas where you can have this done, and I guess the most popular is right around here where we start to show those signs of age. All right, what about this one?
And the same thing. This lady was injected with Juvederm, which is another hyaluronic acid product, and I think, again, it's reversed also.
Yeah.
The one on the right is the before with the folds, and the one on the left is when it's corrected.
Big difference. And what I like about this is it's very subtle, but you still see the beautiful signs of aging, because I don't think that we should run away from that.
No, well, you can't really.
Yeah.
You're just trying to restore some youthful fullness that we lose.
Absolutely. Now, why is it that we see so many of these injections gone bad?
Well, the pendulum has really swung towards thinking that surgery is kind of passé, and that the current myth is you can do everything with a filler, and it's just not the case. And you know, it's complementary to most of the repositioning procedures that we do in surgery.
And then everybody's doing this, not just plastic surgeons. Is that a good idea?
Well, I mean, it's the way it is. You know, there's no law that says that a physician can't use an injection. So it's buyer beware. Pick the best professional you can.
My thought is I want to go to a plastic surgeon because you're going to know exactly where to inject those fillers.
Well, I think it's that too, plus you hear the whole story. You know, you know the whole story about what other options are available, because when you go to a physician, you're really paying for judgment. You want the best judgment you can get, and fortunately plastic surgeons have an array of options.
And do fillers replace surgery?
Not at all. I mean, they really are complementary. The fillers are doing things we could not do with surgery, so it's wonderful.
And I think the million-dollar question is, how do you choose a professional who's going to give you the results that you want?
Well, you have to rely on your own instincts, and you have to trust whoever you're seeing, and hopefully you have someone who's qualified and trained in that specialty, a dermatologist or a plastic surgeon who does this regularly.
All right. Thank you so much.
Thank
Good to see you. Okay, now you can find out more about injectable fillers by calling Dr. Ramsey Choucair at Plastic and Reconstructive Surgery. The number is 214-754-9001, or log onto his website. It's drcplasticsurgery.com. We'll be right back.